Another major public health problem in Oklahoma is prescription drug abuse. Our partners Oklahoma Watch and the Oklahoman are doing extensive reporting on the issue. And I talked to Oklahoma Watch reporter Warren Veith to learn more about what they are finding. Warren, just how big is the problem of prescription drug abuse in Oklahoma?
Dick, we have what most experts agree is an epidemic of prescription drug abuse in this state. Oklahoma has one of the highest rates of prescription drug abuse and prescription drug overdose deaths in the country. Last year, 434 Oklahomans died from prescription drug overdoses, all of them accidental, and at least half of those were taking drugs that their doctor had prescribed to them.
How is this happening?
It's happening, what we found in our investigation, Oklahoma Watch and the Oklahoman, that many of patients started out with legitimate pain problems, bad backs, sore knees, whatever, started on hydrocodone or one of the other opiate drugs, and over time built up a physical dependence on them, and with some subgroup in that population, they also developed a craving and decided they liked taking the drugs, and began doctor shopping, getting multiple prescriptions from multiple doctors.
What's being done about this problem in the healthcare community?
The governor's office has charged her major agencies with trying to do a concerted effort to get to the bottom of this and to reduce the rate of this problem. But what we found is that there are impediments and there are gaps in the existing system that have prevented those agencies from working together well.
There has been a legislative response as well.
There were about a half dozen bills introduced this year that dealt with prescription drug abuse in some fashion or another. As of today, 2 of them have been killed, 1 of them has been scaled back significantly, and 3 others are still alive.
Where's the opposition coming from?
Opposition, a lot of it is coming from physician groups that have been traditionally reluctant to require doctors to check an online registry every time they write one of these prescriptions. But there's also some opposition from legislators who are just concerned about government overreach and overregulation of small business, and in some respects, a lot of medical practitioners are small business operators.
How long does it take to check the registry?
90 seconds. We timed it. We had doctors run PMP checks, and that was the average, 90 seconds.
What's the most alarming discovery for you during the course of your reporting?
Well, the fact that despite everyone's good intentions, it's difficult for the various branches of government to really work together effectively. The medical examiner's office takes months to finish a death report when someone dies of an overdose, and it doesn't collect any information on who prescribed the drugs. The Narcotics Bureau has data that it collects on all these prescriptions, but it's prohibited by law from sharing some of that information with others. The licensing boards, which are in a position to do something with the doctors, don't have access to information, don't even know that the deaths have occurred until well after the fact.
And there's more reporting to come. Warren Veith from Oklahoma Watch, thank you.
Thank you.